Hello, everyone, and welcome to this breakout session titled How a Behavioral Economic Framework Can Support Scaling of Early Childhood Interventions. My name is Rebecca Dorr. I'm the Director of Research here at the Crane Center. My colleague Janelle will be monitoring our chat box and keeping you informed there with any housekeeping items during the breakout session today. We are really looking forward to an active and engaging discussion in this session and to continue to challenge ourselves on how we rethink family engagement. I am very pleased to welcome Dr. Lisa Gennetian, who is the Pritzker Professor of Early Learning Policy Studies, a professor in the Stanford School of Public Policy and faculty affiliate in the Center for Child and Family Policy at Duke University. Dr. Gennetian is an applied economist whose research focuses on child poverty, including income security and stability, as well as early care and education. She is particularly interested in identifying how child poverty shapes children's development. In her work, Dr. Gennetian applies insights from behavioral economics to design strategies that support parent and family engagement in existing childhood interventions and to enhance the impact of those interventions. Today, she will share specific examples from home visiting and parenting programs of maintaining quality and connection while scaling the intervention services. These insights are included in the piece she authored that is also the title of this session, How a Behavioral Economics Framework Can Support Scaling of Early Childhood Interventions. We are thrilled to have Dr. Gennetian here with us today to share how combining conventional economics with social psychology and cognitive decision-making can offer a lens that ensures families and programs scale with connection, quality, and fidelity. And with that, I will turn it over to you.
Thank you so much. What a wonderful introduction. And I'm really happy to be here right now. I really enjoyed Dr. Harris's talk. As well as being introduced to him. My transition to Duke has been relatively recent. And I'm going to take the work that I'm going to talk about today, and this perspective is a wonderful companion and complement to what you just heard from Dr. Harris, who was really giving a big zoomed out view in thinking about parental involvement and parent engagement. I'm going to zoom really in deep and thinking really on the ground from the perspective of families and from the perspective of folks who are trying to support families in this broader domain of family engagement. So I'm delighted to be here and I look forward to the Q&A. So here's a frame that I'm going to start with. There are challenges of reaching families and understanding their engagement. And again, you heard some of the zoomed out challenges from the perspective of the weight that is put on this mechanism of parent involvement. I'm going to focus particularly on the earliest years of children's lives, so 0 to 5, before they enter a systemized platform called public education, public schooling, which was predominantly the focus of Dr. Harris's talk. We have this dilemma through this 0 to 5 age frame, especially in the US, that there's no systematic platform, right? There are multiple touch points in which families interact with society with formal systems and services. Yet it's a very rich time in which lots of programs are available to support families. And so when we look at this question of engagement and population level types of programs, we see lots of good intentions, really good programs, but very low kind of uptake and very low follow through. And I'm just showing here kind of a scattering of some of that evidence. In a population level trial of a program called Triple P, only 1% of parents participated in this group-based type of intervention. 5% of parents participated in a parenting intervention called In the Communities That Care. This was at the trial basis. It wasn't even ready for scale or not evaluated at scale in terms of participation. We can also think about things like family court systems as mechanisms for also offering kind of parenting and parent support. And one study here only shows 10% who actually attended one or more sessions. So there is this dilemma of having kind of rich services and programs available, and parents, and probably lots of parents and families with very good intentions, but a mismatch, right, of what's happening with the availability of those services and uptake. We also see this happening when we talk to parents about what they know and what they intend and what they actually do. So just as one way of thinking about this, I kind of pulled this out as just one example. Nearly 90% of parents realize that reading books aloud, this is British, is important to their children's early brain development. But surveys show that only half of parents read to their young children daily, and less than 10% read to their children from infancy. So on the one hand, you could take the 90% and say, wow, all the efforts around education and information campaigns is one example that we know there's been just a burst of activity around early childhood development that's been out in the public, has really maybe increased knowledge and maybe even increased intentions. But when it actually comes to changes in behavior, it's a much harder thing to change. So let me offer kind of this slide in the way that I've been thinking about this. So I come from training in economics, but I'm very interdisciplinary. So I spend a lot of time with child developmentalists, sociologists, psychologists, kind of broaden the way I think about families. And so I think about three factors across these three domains: resources, meaning monetary resources primarily; time, which certainly is a resource; and then a third resource, which I'm going to call mental bandwidth here. We can call it mental resources. We can call it attention. Cognitive resources, not IQ, not intellect, but resources that are related to our cognition. And those resources, our cognitive resources, also come with some biases. And these all three together can shape and inform how parents make decisions. So as an example of this, you see the table on the bottom. So if you ask parents, you get some data from them, what are the factors that prevent them from reading books to their children more often? And so we see right away, there's the financial source. Books are too expensive. We also see a very typical response that you get almost any time you ask parents, why aren't you doing X, Y, and Z? I just can't find the time. So that's your time resource. But then we also get a variety of other responses. Admittedly, they're at lower rates, but they exist, they're present. I don't like reading out loud. I was not read aloud to as a child, so I don't see it as necessary. I don't feel confident reading out loud. And this is really where that third, the purple bucket here, comes in as an interesting additional lens to think about supporting family and family engagement. So just kind of stepping back, there's a lot that's been learned about the science of parenting. It's quite advanced, comes mostly from the scholarly community, and it's this wonderful science that has helped inform the development of many rich interventions. One thing we've definitely learned is that the science of parenting takes a lot, right? So these are some fancy words, but this is sort of what, these are the ingredients that go into thinking about support and supportive services: working memory, emotional regulation, grit, humor, structural support, financial resources, healthy adult relationships, balanced mental health, cushion for recovery when things go wrong. It takes a lot. So we know a lot of science. We're pretty good at this part. The challenge is the reality of parenting, especially in the context of poverty, is very complicated. And it's very far removed, right, from kind of the idealized, theorized, and even evidence-based elements of the science of parenting. And here I list some examples of that: on and underemployment, unpredictable work, unreliable social assistance, little wage growth, limited family support, hardly any savings, patchwork child care. I'm sure all of you could add more to this list: racism and discrimination, little cushion for recovery when things go wrong. So conceptually, we also have a mismatch of idealized notions, good intentions, even well-funded programs with reality. So this is where I think behavioral economics can really make a difference. So it is an interdisciplinary framework that blends conventional economic theory, which is based on these kinds of assumptions: that people have well-informed preferences, that we act self-interested, we compare costs with benefits, with the science that is coming out of and comes out of social psychology. And in social psychology, we think about attention and self-control. These are the cognitive resources. We think about the gaps between intention and action. There is a place in social psychology to think about procrastination and temptation, and social influences. So why does this matter from a program, policy, family engagement perspective? To me, this all matters because it really points to different types of levers and levers that we can use in really responsible ways as we're thinking about policy and programs. So economics offers these levers of prices and budgets and things like transaction costs. Social psychology uncovers complementary levels. Context matters, a theme that we just heard about from Dr. Harris. How we design choices, things like defaults, cues, anchors, our social environment, those all matter as well. So how are these translated? Well, we typically think more, I should say, about the kinds of levers that come out of the framework of economics, right? We think about costs of transportation, how to subsidize that. We think about availability of childcare. We think about food as a financial incentive. And we actually also think about financial incentives, right? To help compensate people for their time spent in programs. What we think less about is what comes from the field of social psychology, that parents might be wearing and being asked to have different identities as they're living in different parts of their lives and responsibilities. And perhaps their identity as a parent is not a positive one that's affirmed, and that's something that we could think about. It is difficult to always think about how your activity in the present can have lots of benefits long-term. This is especially hard when you're thinking about, how should I be reading to a 10-week-old? How is this going to make a difference in that 10-week-old's likelihood of high school graduation? And we make lots of assumptions about how choices are active and deliberate when in fact they're very passive, often they're passive, and they are a result of inertia rather than active choices. So this book was a fun opportunity to think about scale-up effects more generally, and there's lots of perspectives in this book. The one that I brought was very specific about behavioral economics and how we can really integrate that into this idea of scaling and reaching all populations and how to do so in a very streamlined, low-cost way. And in the book, I talk about kind of 4 pillars: how choices are designed, fear of judgment, which interacts with stigma and stereotyping and the kinds of biases that are presumed in the kind of field and assumptions of family engagement, some of which we heard a little bit earlier, misperception of the situation and future benefits, and then the last pillar of social norms. I'm not going to go through all of these in a lot of detail. I'm going to talk about a few of them through a concrete example, and then demonstrate kind of how these have translated into real kind of design enhancements for each of these buckets at the end. So now I want to talk through a real example. One of the things that I've especially loved about this work is that the deep time it requires with real people, real families, understanding their situations and circumstances, and understanding the goals and objectives of directors and program managers and frontline staff. And kind of that thorny challenge of how to recognize everyone where they are and how to make the best, right, of engaging them at the level that will have the best outcome for both sides. So in this one, I had the opportunity to work with New York City's Department of Health and Mental Hygiene. It's a tricky one. Their newborn home visiting program that has been around for decades. That program had a conventional focus on child safety and then breastfeeding. At the time of this work, which was in the 2014-15 time period, was also kind of an infusion of kind of public health level type of activity around early learning and literacy. And New York City Hall launched this Talk to Your Baby texting program that was reinforced by some leaders in New York City government. And the third component here is the New York City library system. So here is the problem, broadly defined. Many existing public health and citywide initiatives, very well intended, fully funded, and trying to have some citywide impact, all targeting the same families, in this case, parents of infants. And none of these programs are integrated. And in fact, they often compete with each other for parent take-up and involvement and intention. So we try to bring some ways to think about this, and how do we think about integration of these initiatives in a seamless way that's productive for everybody, for the families and for the city and the investments. We thought about inertia and decision making. We thought hard about distractions and how to support attention on these activities. We thought about identity conflict and present bias, which is this idea of it's very hard to calculate future costs of what you're doing today. So how can we make that calculation easier? And just a note on kind of methods. So doing this work often requires 6 months to a year, really spending a lot of time, right? So focus groups and surveys with families and talking to program developers. And then we design what we call a behavioral economic enhancement. So these are all considered superchargers, kind of boosts. And then in terms of the research, I do a lot of what's called randomized control trials. So half of the parents or families engaging will get one kind of package, one bundle of, let's say, outreach and implementation, and another bundle of families, or the other half will get a different bundle. And then we can compare their outcomes over time and see if we're actually having any impact. So in this work, there's a very big theory of change. On the left, there are all these wonderful resources that are available, again, from like a public health perspective. They rely on parents taking up the resources and doing things like reading them. So in this case, increased reading of actual text, let's say, if they're signed up for this text-based early literacy program. And then the theory would contend that parents will shift their behaviors in the way that's reinforced through that education and information, right? Singing, reading, talking. That will translate to some outcomes that differ for infants related to eye contact and babbling, reciprocity, and smiling. These are all kind of the seeds that are the beginning of early learning and literacy that translate then to print awareness, word recognition, vocabulary that then translate to actual reading and talking, what have you. So in this work, we really focused on the left side, right? So what's happening with the availability of all these resources in the community and parents actually taking it up and reading it? And then is that actually translating to changes in behavior in the way that the resources were designed and intended to do? And so here in the red is kind of how we were thinking about. So again, these are, and again, I didn't emphasize this, but the newborn home visiting program targets hospitals. They recruit moms in hospitals that are predominantly from lower income areas in New York City. And so we really focused on that context. And so we identified these 3 areas, and then we developed a variety of what we call behavioral economic interventions and streamlined them into the newborn home visiting program. So in practice, this is what it looked like. There were 3 services on the left. We were focused on use and uptake and really looking at its impact. If we could change uptake according to the logic model, right, on the margins, if we can change uptake, we should also see some changes in parenting behaviors. That's why we have these programs. We hope to see, so in some ways, this is a proof of concept of the logic model. So here are the 3 things we did in kind of broad strokes. So typically, it is the case that most programs, even especially sort of those that come from kind of a public health lens, are voluntary involvement. Of course, they should always be voluntary. What that usually means is that it's an opt-in. So parents need to make, families need to make an active choice to sign up, and that usually requires many steps. There are many, many things that can get in the way of those good intentions: inertia, uncertainty, competing demands. It's just easier to maintain status quo, to say I'll do it later. And even among those parents with high intentions to enroll, actual enrollment is low. So we worked with DOH-MH to shift the default for half of the families at their first home visit. Instead of giving them just a folder, a really fat folder with a lot of information and one very nice little postcard tucked in about the Talk to Your Baby program, which was usual practice, The home visitor defaulted them, so with their consent to participate in the study, plugged in their phone number and signed them up for the program. And so this shifted the responsibilities so that the parent could then opt out. I actually don't want to receive this, and reduce kind of the burden of all those initial steps. Here is a picture of that Talk to Your Baby program. In addition to the usual text messages that the parents got, so they were developmentally appropriate. You can see the day 22, 68, and 114. I should also mention that in those initial steps of many of these text-based programs, it's not just putting in your phone number. It's usually a birth date. It's usually 3 or 4 pieces of information, including language translation. So it is not just a simple press of the button. Sometimes each of those steps can act as incremental, right, residual barriers. So here's the text-based Talk to Your Baby program. We inserted additional messages. We did things like personalized it to the baby's name. We added some more kind of positive reinforcement of the developmental oriented messages on the text-based program. And in a minute, I'll show you some ways that we also infuse some positive affirmations. So the next thing we did was we thought about how to positively invoke a parenting identity that is based on parents' existing capacities. Parenting advice information can be threatening, particularly for parents who feel stigmatized or judged, who feel like they are not enough or viewed as not enough from society. In fact, we know when parents who are asked to reflect on values or proud moments as a positive affirmation, they feel more empowered, it dilutes feelings of judgment, and as a result are more receptive to parenting programs and materials. Here is one way that we infuse some of that positive affirmation. It was through the text messaging. Being a new mom can feel overwhelming sometimes, but you're doing a great job. What was one new thing, again, children's personalized name, has done since I saw you last week, something that made you smile. Oops. In that second home visit, we added another element. This is a really homegrown, pretty simple video where the home visitors showed it to the mom as examples of positive, eye-focused, reciprocal contact between parent and child. So parents saw this with some positive messaging at their second home visit. We did something else. So the conventional newborn home visiting program ended after the second home visit, and then there was nothing else. We thought it would be nice to continue to build on this integrated theme of resources in the city, focus on early learning and literacy. And lucky us that there's a very robust library system in New York City who had an enormous inventory of wonderful reading materials and donated it to our research endeavors. We sent a nice 5-month-old baby birthday present to continue kind of to make present the importance of engaging with your children in learning and to make it feasible. So congratulations on the birth date. Books are fun, even engaging with books, touching them is a positive thing to do for supporting literacy, along with some actual books and learning materials. And we did more than that. In that same package, parents received a flyer at 5 or 6 months. Babies and families are sometimes ready to socialize and to socialize on elements of learning, and also just to introduce families to what is available in the community by way of other types of book clubs and book resources. We focused on the library. We completed a library card application with the information we had available and a quick checklist so that it seemed very feasible to do these last steps, and it included the library card. So the parents just had to activate it, along with a map of where all local libraries were close by. So right off the bat, we learned that the default option of enrolling in programs can really matter a lot. So we've seen this in other domains, and now we're beginning to see it more and more when it comes to supportive kind of services in early childhood. So the families that were automatically enrolled remained, were much more likely to remain in the study. So 89% versus 1% in the control group. And remember, here in the control group is our usual methods, right? So that was through advertising, in subways. I don't think there was TV. So it was mostly subways, taxis, and of course the information packets they were getting from the newborn home visiting program. What I like to show here, though, is not just the effectiveness of how many kind of enrolled compared to how many enrolled in the comparison, but also how many chose to opt out, which to me is an indication of we are not limiting choice. We are just changing where you're starting at the gate, right? So 11% of the moms, they were automatically enrolled and they decided to say stop. And again, they could do it in Spanish or English in this case. We had some information about the characteristics of the moms. We were really curious about whether the opt-in, opt-out kind of decision or the opt-out decision varied. And we did not see anything systematic. So there were no differences if they were a first-time mother, the language of the intake, the number of children in the family, a little bit of difference if they had been receiving any benefits from the Women, Infant, and Children program, but not statistically different. And little difference and not statistically least in the length of residence. So this is also an interesting, I think, finding that there was broad comparability across some predictors that you might otherwise think are very correlated with whether a parent is going to decide to opt out of an early learning program. So setting the option to leave versus the option to join is sometimes confounded with this ethical dilemma of paternalism versus autonomy. And what I'd like to point out with these findings is that, a reasonable 1 out of 10 mothers opted out and at similar rates across varying risk groups. So next you might ask, well, does this really matter? And we cared about that question too. So we launched a follow-up to ask moms. But I also like to think about this thought experiment. So if less than 2% of the 89% of the mothers who did not opt out actually read the messages and actually changed their behavior, that would be 4 mothers. This is alone double the 1%, 2 mothers who voluntarily enrolled, right? So in the comparison group, the number of people that could even potentially have changed behavior or responded to the intervention was 2. So less than 2%, right, of the ones who did not opt out. That's all it would take to make this sort of a reasonable cost effectiveness analysis. So the benefits outweigh the costs in this case is part of my argument. And I think it's really interesting to sort of take pause. So we have these high to low stakes, right, opt-out defaults that surround families. Public schools is a wonderful example of this. You just heard about that earlier. We don't ask whether there's an opt-in there, right? That's automatic. Of course, families can opt out. They could choose to teach their children at home if they satisfy paperwork. Child immunizations, use of car seats and seatbelts, child protection, annual preventive doctor's exams. These are things that are opt-outs. Why isn't, it's just a question, why not think about the variety of other things that we've built out to support early childhood comparably as opt-outs? We had the opportunity to follow some of these families and to ask them some questions. Are they actually talking, singing, reading, and playing? And we did this both through their reports via text. So these were rapid fire kind of text data. We also left something called a Lena device. So this is an audio recording of all language that's happening in the house for a 24-hour period. We picked up the Lena devices the second day. The data I'm showing you here are from the self-reports, although they've been kind of verified from Lena devices. So we didn't see very many differences in talking or playing across the 2 groups. Where we did see some differences is in reading. So fewer mothers in the group that received the interventions I just talked about report never singing in the afternoon. More mothers in the B group report never reading in the evening. The opposite way to think about this is more singing and more reading. among the moms who were had the opt-out, had the positive affirmations, had the reinforced text messages, and the 5-month birthday package. So here's that statistic. More mothers in the B group report seeing sometimes in particular. And then reading. I want to show you a few more examples. I think I have a little bit of time. So let me show you some other examples from other projects that speak more directly to the 4 pillars that I talk about in that chapter. One is around choices. The research I just showed you focused on that kind of initial in the gate choice about whether that's voluntary, opt-in or opt-out. Another way to think about this is designing passive to active choice. So making very clear what no means. And here is an example, and actually we didn't end up using this exact language. I'm seeing now that I should edit this. But when we're checking off, making sure it's very clear, kind of when you agree to something, what you are agreeing to, what it means, translating it, but also when you're agreeing not to do something, right? So that's converting a passive to an active choice. So this is an example where you get a personalized invitation, I will attend, which is usually what we see. But also if I do not attend, this is what it means, right? I will not attend this parent program. I won't be able to take advantage of this opportunity to help my child succeed. We have shifted this language because we're abundantly aware how this sort of sets up this notion of failure. And so this has been revised. This is just an illustration. Here is another example of how we can change menus of choices. So this was a program called Getting Ready for School. It was designed for 3 to 4-year-olds, implemented in Head Start centers in New York City. It's portable and coordinated. So any provider, teacher, or parent, or grandparent, or sibling is engaging in comparable types of activities with the child. So teachers used to write these really long letters that went home to parents every Friday with a little tear off at the bottom that asked the parents to record all the work they did with their child and return it. And unsurprisingly, it wasn't a very effective form of communication. There weren't very many tear offs going back. We completely converted this and we made a fun activity chart, which I'm not showing you. So the children were much more engaged and looked forward with stickers. So the children were engaged in pointing out and feeling motivated and goal-oriented to do these play-based activities. We also simplified kind of the task list, right? So here, this week's activities for your child, there's only 3, not 15 options, 10 minutes each, bite size, and 1 bonus, your favorite. The idea with the bonus and your favorite was actually an insight about unpacking this type of learning activity work from our traditional mindset of homework. Homework is one and done. It's very checklist, box checking style, and very contrary to the routine, habit forming kind of nourishment of early learning, even if it's the same thing every day. And so we were trying to design materials to reinforce that kind of benefit of habits, engaging again and again in things that bring joy. On fear of judgment, I showed you the way that the videos were combined with script and text that affirmed kind of parents' existing capacities, that they already have tools to have really positive interactions with their children. We kind of put this out there to try to get more of a national-based sample on whether these types of pride-based reflections can actually change how parents react to things. And we found that it did, right? So this is a larger sample. We put it out there in the digital world among parents of children, racially, ethnically heterogeneous. And we had them do this pride-based reflection. So it's 3 prompts, and you're kind of remembering moments that you're proud of. And then we ask you a bunch of other questions. And right here, we start with, how do you feel about yourself right now? And you see that upon the families or the individuals, the parents, who were asked to sit back and reflect on something they were proud of, were much more likely to say they felt better about themselves. And then we asked them, hey, are you interested in getting some stuff? in learning about parenting programs, they were much more likely. In attending a program, so these are just self-report. Are you interested in attending? More likely. And then the one tiny thing that we were able to do with behavior change is, would you be willing to give us your email and we can send you some resources? And here we didn't see a statistical difference, but we still see a little bit of an increase on the behavior side. Here's another format of positive affirmations. This is yet another program in New York City called Parent Corps, building out of community-based childcare programs, a very strength-based relationship program. And here we built out something in a postcard. So this is something that parents, caregivers will fill out in their first session of this group-based parenting program. And then it's mailed back to them. And so a couple of weeks later, they're reminded of all the things that they said they're successful or proud of. This third pillar is about feedback. One thing that's been striking to me, and I'm sure to all of you, is we all think our children are above average, or perhaps we underestimate our children's skills. There are many examples of when parents are informed in a careful way about how much time they've spent doing things, right? So some calibration of reality with what they think they did, as well as how their children are doing, is usually, it can be a reset moment, right? And can act as a moment even for them to either increase their behavior or adjust their behavior. And here's an example of materials that we recreated that actually happens during a parent conference. You know, there's some, we can talk about the value of that. But again, I was not in the position to change what the program was already doing, but was in the position of maybe changing what that correspondence would look like between parents and teachers. And then the last is thinking about social norms. So this is not the most powerful example of a social norm, but this is a case of where we took a flyer and converted it into a personalized invitation. And we did have a little bit of norming here. So one is that this is valued by your teachers. There's also some norming here about you are a parent. You can also consider yourself a teacher. And then finally, some principles that feel intuitive but are not always implemented is to always try to make things easy and always to remember that parenting is a very difficult job and parents are juggling circumstances, many of them very draining circumstances. Reminders, commitment devices, these are all tools that many of us use in our day-to-day. And why not incorporate them into the creation of, again, these really well-intended programs to make it easier for families to engage. I want to end on this note that I touched upon when I talked about opt-ins and opt-outs regarding paternalism, and that it is, while it is completely possible, right, to think about these types of enhancements as being coercive or manipulative, certainly there is a private profit-making sector that knows this and does this well. It is also possible to do these in a socially responsible and effective way that is helpful and supportive of families. And so I, always try to remember kind of this checklist of items when we're thinking about, when we're in this business of going beyond science to actual implementation, we're actually affecting what families are receiving and experiencing. And I am done with the formal part of my talk, which is right on time. It's 2:13.
Wonderful. Thank you so much. This is so interesting to hear. I want to open up the question and answer session to anyone who wants to put a question for Dr. Gennetian in the Q&A box, and I can relay that over to her. I'll start with a question for myself as a very new parent in the last few months.
Congratulations.
Thank you. We have an app, like this is a sleep app, and it seems like it sort of gamifies sleep, right? So it gives me tips on like, here's something you can do to help your daughter sleep better. And then if you do it, then it like says achieved.
Gives you a little star, yeah.
Yes, exactly. Like a sticker, basically. I wonder if you could talk about sort of like gamification, if there are programs or ideas that are taking some of the sort of ideas that you're talking about here and sort of gamifying the experience of parenting, and it all.
Yes. So there is, the answer is there is. And there are actually academic institutes and nonprofits now thinking about even taking some of the elements of family engagement from science and trying to put them into really fun app-based gamification, if you want to call it that. I think especially what we're learning is to get other types of caregivers, like fathers, involved. There is something appealing about gamifying. So it's definitely happening. You were smiling while you were talking about it. So anything that gives you, I think if you think it's fun and joyful and it's also good for you, even if it's not having a positive impact on the quality of the sleep you're getting because you have such a young child, it's still making you feel better. And I think that's worth it. I personally have not worked on any kind of app-based or game-based interventions, just because it takes a different type of investment. And I will also say that it doesn't quite line up with that first thing that I talked about, which is how much are we demanding of parents do versus, being available to them without taking action. And apps require engagement, active engagement, versus even text, right? So we had to make an early decision on some of those ways of communication on whether we do it through SMS or we do it through some kind of app. And, apps require settings, right? And you can control notifications. And those are all additional steps versus texting. So yes, and I'm glad you're enjoying it.
Great. Thank you. Okay, we do have some other questions coming in. Mary Beth asks, have any programs implemented opt-out that you know of other than sort of, I guess, the ones you're talking about?
Oh, really good question. I don't know, not in early childhood. I don't know of any. I would love if any of you know who are on this breakout, please let me know. I actually don't even know if the New York City Department of Health and Mental Hygiene has shifted what they do at that first home visit. So that's on me to follow up with them. So thank you for that question, because that means maybe I was a little convincing in thinking about it. And I will go back to literature and see if there's more. There's certainly been some shifts more in the public education space, I would say, than early childhood right now.
Yeah, that would be really interesting to see if they did implement those. Great. We have another question coming in from Annalisa Johnson. Is there a sweet spot for texting or family outreach? When is it productive and when does it just become background noise for busy families?
Yeah, excellent question. I'm glad you asked that. And I should have put in another slide. So, right, there are trade-offs. We know lots of people spend a lot of time on phones. If you're spending time on phones, you're not engaging with your child, right, in the direct, interactive, eye contact way. So there's that kind of trade-off happening. I think the evidence is still not clear about whether smartphone technology is actually taking away quality time with children. So let's put that in the parking lot for now. But the other thing is, like, we've learned a lot, right, about engaging with families in text. So first, there's definitely a novelty effect, right? That first text, that first click through always has much more engagement. You can definitely see a pattern of fall off after 3 or 4 or 5 weeks. I know that from two tests. One actually just tracking what's happening with click-throughs. The second is we randomized the time in which you got a text. And so if you lower kind of this, there's another trade-off with, habit formation. I know every Friday I get my nice text from like Jessie that tells me, gives me my little tip for the weekend. And in some ways I might continue to look forward that. But the opposite is like, yeah, whatever, it's another text from Jesse on Friday, I'm tired of those texts, and they're going to get them. If we randomize when Jesse's sending texts, you continue to see kind of these little blips, right? So each time it comes, it's almost like you're harnessing that novelty effect again. There's a third thing that we've learned, and this is I think, really important thing. It's a trade-off with personalization. And so when you personalize both the parent's name and the child's name as an example, sometimes the recipient thinks there's a real person on the other side. And in most of these programs, it's never, we can automate all of this, right? Even the personalized name. So there is a real cost to breaking down trust, right? And making it seem like a mechanical experience if the recipient thinks there's a real person on the other line. So we've, in the second or third rounds of my work in this, we've actually scaled back and personalizing to the individual. And we've done more to associate, to make it clear that this is a program. It has a, there is a person associated, it's a human, right? Human created program, but it is not a human ready at the other side to respond to you. So thank you, really good question.
Thanks. That's really interesting about sort of the backfiring if you go too far.
Yeah.
Good. We have another question from Kelly Pertel. She said, "Hi, Lisa. Great talk.
Hey, Kelly.
I'm really struck by the findings at the end of your presentation about the impact of having parents reflect on things they're doing well. Have you thought at all about where else we can provide parents with these reflection opportunities, or have you seen other examples?" Yeah.
I mean, I think we can provide parents positive affirmations on a minute-by-minute basis, Kelly. So that's not possible, but I think, the written, the text, the videos, there's no reason why we can't incorporate these positive messages in almost everything that's created with a parent target. They're pretty easy to do. So I don't know, let's be creative. Parents are waiting at the doctor's office for an appointment. They're going through the forms. What if at the end, the form just said, "Hey, what was a proud moment that you experienced with, little Scotty today?" Can you imagine what that would feel like once you go into the doctor's office? I mean, I think there's lots of ways that these can be seamlessly incorporated. The proud moment language I didn't have a chance to really, we also learned some differences between value-based and proud-based reflections. So proud-based work much better than value-based in this domain of parenting, and I can talk to you about that offline. But otherwise, not a lot that I can think of right now in terms of negative or unintended consequences. So yes, please integrate them into your work, and let's build up a body of evidence.
Yeah, absolutely. We have one more question from Joan, who asks, "How detailed is the book chapter that you were referencing during your presentation, and how do we get more information and tips about this type of work?"
Oh, gotcha. Oh, wow, that's fun. The book chapter is not hugely detailed because it was a short book chapter. I do have a website up called bell.org, BELL.org. It needs to be updated, but there's a lot more information there about this work. And I don't know how I can make some of the references on that last slide available. Those are publications. Many are open access, and I think are relatively accessible. So they're not kind of heavy on math and equations and that kind of thing. So those are the three. And email me. I'm happy to talk more.
Great, thank you. Well, I think that's a great place.
Thank you, Kelly.
To leave off. Kelly's putting the website in the chat for anyone who wants to access that.
Yeah.
Well, thank you so much for speaking with us today, Dr. Gennetian. We really appreciate it. It was great to have you involved in this discussion, and I hope everyone will join us in the final discussion coming up here in a few moments.
Sounds great.
Thank you all for being here.
Thanks, everybody.
Bye.